Hello, attendees of the 8th Annual Conference of the International Organization for Health, Sports, and Kinesiology. Thank you for choosing to view this presentation. I very much appreciate this opportunity to share some of the work that our campus has done related to the ACSM's Exercise Medicine Initiative. It's been a collaboration on our campus that has spanned several years, and we're all still just as motivated and enthusiastic as when we first began. Thank you for choosing to spend the next 40 minutes with me as I take us through this presentation entitled ACSM Exercise Medicine on Campus, One University's Journey Through Program Registration, Campus Recognition, and Initiation of Research Endeavors. Please allow me to first start by introducing myself. My name is Jason Ng. I am a professor of kinesiology at California State University, San Bernardino. I also previously have served on the American College of Sports Medicine's Exercise Medicine Credential Committee. Now I currently serve as a representative on the Faculty Advisory Council for the ACSM's Certification Board. I do spend most of my time as a faculty member at our campus, though. So there are 23 California State universities, and our campus, California State University San Bernardino, or CSUSB, is located in Southern California, about 100 kilometers away from Los Angeles. Our campus has a kinesiology department, and we have almost 1,000 students in our major. At CSUSB Kinesiology, our department teaches and follows guidelines set by major professional organizations such as the American College of Sports Medicine, or ACSM. Today, I was invited to speak about our journey with one of ACSM's programs, the Exercise Medicine on Campus program. Hopefully, by the end of this presentation, we will get a couple of things. So here are a couple of goals. One, hopefully by the end, we will know what Exercise Medicine on Campus is. What is the Exercise Medicine on Campus program? Two, we'll know how to register our own campus to be an ACSM Exercise Medicine on Campus. And three, we can get some ideas of what we can do at our campuses after hearing about what CSUSB has done on this campus. So we can get some ideas from CSUSB's journey. Let's get started with our first part, this question of what is ACSM's Exercise Medicine on Campus? First, to answer that, let's ask, what is Exercise Medicine, or ACSM? To answer this, let's back up to July 2012 in an issue of The Lancet, a well-established journal of the medical community. A special issue was released dedicated to physical activity. In it, there was a line that summarized one of the most important messages in that issue. It is that in view of the prevalence, global reach, and health effect of physical inactivity, the issue, that is the issue of inactivity, physical inactivity, should be appropriately described as a pandemic with far-reaching health, economic, environmental, and social consequences. In other words, physical inactivity, or the lack of movement, while it might begin as or might seem as a personal issue of the individual, the consequences affect not just the individual themselves, but actually has far greater global effects, which is what is considered a pandemic. The word pandemic has gained much more attention recently with the COVID-19 pandemic, but we know it's not a new term. And in fact, physical inactivity was already deemed a pandemic several years before the COVID-19 pandemic. For example, in a World Health Organization report that listed deaths around the world attributed to the 19 leading risk factors, physical activity was the fourth. Above physical inactivity, or physical inactivity was the leading risk factor of death, that is, and it was the fourth one. Above that was high blood pressure. High blood pressure was the first leading risk factor. Two was tobacco use. And three was high blood glucose. Then we have number four, physical inactivity. Number five was overweight and obesity. And number six was high cholesterol. Now, here are a couple of important things to consider about this figure. Of those top six leading risk factors for death, five of them can be addressed or are related to physical activity or physical inactivity. Also, So actually, let me back up for a second. So if we say out of the top six, right, high blood pressure, tobacco use, high blood glucose, physical inactivity, overweight, and obesity, and high cholesterol, of those six, five of them are can be addressed or related to physical inactivity. So um, high blood pressure can be affected by physical activity. High blood glucose can be affected by physical activity. Physical inactivity is again going to be then addressed by the opposite, which is physical activity. Overweight and obesity can be addressed by physical activity, and high cholesterol can be addressed by physical activity as well. Now, in the United States, of these top six leading risk factors, during a clinical visit, the healthcare provider, the doctor, the nurse, they check all of them except for physical activity. So, high blood pressure, glucose, overweight and obesity, high cholesterol, those are all frequently checked. And physical activity for a long time was not a thing that was asked. So, uh, in other words, at every clinical visit, the doctor would check the patient's blood pressure. They ask if they smoke. They question their blood glucose levels. They measure their body weight to determine overweight or obesity, and they question their cholesterol levels. But what about physical activity? In the past 10 years, though, some of this has changed due to widespread messaging, due to this effort that physical activity should be addressed. It should be assessed or checked during every patient visit, just like all the other risk factors. And much of that effort to spread that messaging started because of the partnership between the American Medical Association, who needed trustworthy and qualified exercise professionals trained to treat diseases, and they partnered with the American College of Sports Medicine, or the ACSM, who trains these exercise professionals to apply scientific evidence to their practice. Together, they created the Exercise Medicine Global Initiative. So, what is the Exercise Medicine Global Initiative, or the EIM for short? So, for moving forward, as we refer to exercise medicine, you'll probably hear me refer to it as EIM as well too. So, EIM is just going to be the common abbreviation that we use for exercise medicine. The goal was to establish physical activity as a standard in healthcare. That is, the goal is to transform medical systems around the world to assess and prescribe physical activity just as much as all the other risk factors are assessed and addressed. So, to do this, new responsibilities and professional collaborations need to be established. So, healthcare providers were being called to begin assessing physical activity levels during every patient visit. This could be as simple as incorporating something called the physical activity vital sign, which we're going to see in the later few slides. They can also use simple, fast, and effective tools for prescribing physical activity to prevent, treat, and manage some identified chronic condition. Resources are available for the healthcare providers, such as the exercise prescription pad and there's a series of handouts called the Prescription for Health series. So I'm going to give some examples of that again in this presentation. Healthcare providers were also being asked to refer patients to exercise specialists, to send patients who need exercise to see an exercise specialist to get the exercise treatment. Now, on the exercise specialist side of things, or the exercise professional side of things, what's happening there? Many exercise professionals already exist. Some are more qualified than others. So, a network of trusted exercise professionals need to be developed. Trusted by who and in what way? This group of exercise professionals need to be professionally trained to understand the medical system, how to work with healthcare providers, and how to treat chronic conditions with exercise. This has meant this meant changing the way exercise professionals are trained, and the ACSM has developed standards for this. For example, certifications should be obtained, and they need to be accredited certifications, and training programs need to be accredited as well. So, regarding accrediting certifications, the ACSM already has that process done with their own certifications, such as the Certified Personal Trainer, the certified exercise physiologist, and the certified clinical exercise physiologist. Each of those three are all accredited certifications. Regarding accrediting training programs, That process needs to be done by the academic programs that grant degrees. So, for example, our campus, California State University San Bernardino, or CSUSB, just initiated the process to get our degree program accredited so that students that graduate from a program with our degree can become exercise professionals to work with the medical community later on. In summary, exercise as medicine is the transformation of healthcare around the world to get doctors to check physical activity just as normal as they would check all the other risk factors, and to connect these healthcare providers with a network of trusted exercise professionals that are trained to use exercise to prevent, treat, or manage chronic diseases. So far, I've been talking about exercise as medicine, or EIM, but this presentation is about exercise as medicine on campus, or this other abbreviation, EIMOC. So what is EIMOC? Well, the academic campus can be viewed as a microcosm of the larger society for implementing the EIM model. Many academic institutions have healthcare providers. Many academic institutions have patients. For example, students, staff, and faculty are often patients at the academic institution. Many academic institutions also have exercise resources, such as fitness centers, personal trainers, exercise sessions or group exercise classes, health and exercise workshops. So academic institutions can register with the ACSM to become an exercise medicine on campus, or EIMOC program. And they'll be joining the movement of other colleges and universities working to connect the healthcare provider with the exercise resources on campus. This leads us to the next part of this presentation. How can we register our campus with the ACSM to be an EIMOC campus? So more details about the information on the next following slides can be found on the ACSM's Exercise Medicine on Campus Action Guide. So that's this document over here. On the bottom right corner, I have this QR code that says Scan Me. So throughout the next few slides, as we proceed, you're going to notice these QR codes. And with that, that's an invitation to scan those, which will directly link you to whatever document we are addressing on that slide. So for example, the Exercise Medicine on Campus Action Guide is an actual document that outlines several steps for how to start exercise medicine on campus. And so I would invite you to scan some of these QR codes as we see them pop up along the way. So again, what's the difference between EIM and EIMOC? EIM aims to standardize the following things in clinical care: physical activity assessment and prescription, connect healthcare providers with evidence-based resources on physical activity in order to prescribe exercise, and create a referral network of trusted exercise professionals. EIMOC is simply the adoption of the EIM model at the college or university setting. EIMOC intends to foster collaborations of different groups on campus that all share the same interest in prioritizing the health and well-being of the campus community, that is, students, staff, and faculty. It also provides hands-on experiential learning for students in exercise science-related programs. This action guide here provides 6 steps to create an EIMOC program on your campus. Here is a list of the steps. And so this is just an outline of the steps, step 1, 2, 3, 4, 5, 6. I'm going to spend a couple of minutes elaborating on each of the steps in the following slides, starting with this one, step 1. So step 1 is easy. It's simply to determine if your campus already has an EIMOC program. So to do this, if we want to find out if our school already is registered, we can simply check the ACSM's website to see if the school is listed. So there's another QR code in the bottom right corner there. If you scan that, it's going to take us directly to the ACSM's website that has a list of all the registered campuses. If your school already has a program, you can contact EIM at acsm.org to find out who the advisor is on your campus and get connected with them and start getting involved. So it's not starting from scratch. If your campus already has one, it's meeting the advisor and seeing what we can do to start getting involved. If you don't have, well, if you do have one, you can still follow along and maybe pass this next information to some friends and colleagues. So if your campus does not have a program yet, we can proceed to step two. Step two is to develop your EIMOC leadership team. So the leadership team is comprised of 5 positions. The first position is the advisor. So this is the lead person that provides structure and guidance for the program and connects the campus with ACSM. They kind of are responsible for pulling everybody together, to keeping the group together, to making the connections among everybody in the leadership team, as well as connecting the campus with the ACSM organization. They must be a faculty member or staff member. And they can come from any department, but the ones from a health-related field might be able to provide more specific guidance on how to implement EIM. There also needs to be, well, let me back up. If exercise medicine is about connecting the healthcare provider with the exercise professionals, that means we're going to have representatives from each of those fields. So there's going to have to be a healthcare professional representative on the leadership team. Because the EIM's primary goal is to integrate physical activity into the healthcare system, we have to have this representative on the healthcare system on the leadership team. This person would provide insight and guidance from the perspective of the medical side. This person must be a licensed medical professional, such as a physician or doctor, or nurse, a nurse practitioner, somebody with a medical license. Now we want to connect them with the exercise side, right? So that said, we want to have a representative from the health and fitness area. And so there needs to be a health fitness professional. This person would provide insight and guidance from the perspective of the physical activity side of things. They must have a terminal degree, that is a doctorate in exercise physiology or a related field. Now, if they don't have a terminal degree, they can the other option is they can hold an NCCA accredited certification, such as like one of the 3 we mentioned earlier, the ACSM's certified exercise physiologist, for example, would be a good one. And so they would qualify as well too if they did not have a terminal degree. Finally, the leadership team also needs 2 students who will represent the student voice on campus. And so the target population that we're working with are students, and students typically represent the largest population on some academic institution too. So of course, we need to have student representatives on this leadership team. Once these 5 positions are filled, we can go to step 3. Step 3 is simple. Step 3 is simply to go online and fill out the application form to register your campus. So again, there's another slide with a QR code on the bottom right. You don't have to register your campus now, but if you wanted to, whenever you're ready, you can scan that QR code and it takes you directly to the ACSM's website where we can register our campus. And this is where we would provide the names, the positions, and the contact information of each of those individuals on that leadership team. Once the program is registered, we can begin to put activities into action by moving to step 4. So step 4, after registering your campus, step 4 is to begin connecting with other departments and getting campus support. This could be through connecting with other academic departments or related majors, such as maybe getting connected with the nutrition department or the nursing department. We can also get involved with non-related majors too, such as communications or marketing. They might not specialize in physical activity and exercise, but they specialize in getting the message out and helping to spread the word and publicizing and sharing information. So they might be another helpful academic department to get involved. We can also get in touch with non-academic departments too, such as, of course, campus healthcare providers or campus recreation. Of course, we want to get students involved because they are the primary target population. Students can also advocate for healthcare to not just treat disease, but to help people by preventing disease through physical activity. Students can serve as role models for others around them. They can promote physical activity to their friends. They can organize physical activity awareness events. They can begin to reach out to the community outside the campus. And students are our future healthcare and exercise professionals, so they can bring with them the knowledge and values of exercise as medicine into their future professional practice. So after we get a little more support on campus, we can move on to step 5, which is to implement the EIMOC program or really put it into action. And we can put EIMOC into action through 3 general categories. One is through um, raising physical activity awareness and promotion. 2 is to uh, administer or produce or create EIM educational activities. And then 3 is the big one. It's to implement the exercise medicine model into the campus health system. So let's talk a little more about each of these, starting with the first one, physical activity awareness and promotion. This means we simply encourage physical activity on campus. This is the simplest one. It's just trying to get people to move. This can be done through many different ways, such as organizing events or activities on campus that get people just up and moving around. Maybe we can set up weekly group walks, or we can set up playing games out in the fields or in the public spaces of the university. So it's just getting people moving. That's the easiest one. For the next one, oh, let me back up, sorry. Um, Actually, no, that's right. So what about the next one, the category of EIM educational activities? While physical activity awareness and promotion is about simply getting people moving, the EIM educational activities is more about sharing information. This can be done in different ways too, such as giving presentations about what physical activity is and how it's good for health, or how to exercise safely, or giving presentations about the EIM initiative. For example, this actual talk that I'm giving right now is an example of EIM educational activity. So later on, when we report the activities that we do at the end of the year, which I'll cover in a moment here, this is one of the things that I'm going to report. I'm going to say that back in May, I gave a presentation about what exercise medicine is all about, and this is considered one of these EIM educational types of activities. We can also distribute materials. The ACSM provides many resources, and a really useful one is this set or this series of um, exercise recommendations based on different um, conditions or circumstances or issues that we might want to address. So the ACSM refers to this as the Prescription for Health series of patient handouts. And there's another QR code that we can scan on the bottom right. It takes us to the ACSM's website with this list of all these different handouts. So of all the different resources, this is probably the one that I have heard is one of the most useful or helpful or impactful by both healthcare providers and the exercise professional. Both groups, the doctors, the nurses, and all the exercise specialists, they all say this is probably one of the most useful resources. There's a variety of handouts that summarize some of the exercise guidelines and recommendations based on different issues the individual might be facing. So, for example, if somebody's experiencing depression and anxiety, how does being active help? And what do we do with physical activity for somebody going through depression or anxiety? Or how about somebody with high blood pressure? If somebody has high blood pressure, how does exercise help them? And how do we start them on exercise? What about somebody who's pregnant? How does exercise help somebody who's pregnant? Should they even exercise while they're pregnant? And what kind of exercise can they do? And so there's a whole list, and they're in different languages as well too. I would invite you, if you can, take some time and look through some of these. They're open to just begin to distribute. And this is an example of EIM educational activities. Now, the third category here of implementing EIMOC is to implement the EIMOC solution or the model. So it's to implement the EIM model into the campus healthcare system. This is about setting up the PAVS or the physical activity vital sign in the healthcare center so that every patient that is seen is checked on how much physical activity they're doing, just like they're checked on other basic information like height, weight, blood pressure, and they're asked about behaviors like whether they drink or smoke. We're encouraging healthcare providers now to also ask about how much exercise or physical activity the patient is getting. Um, So this can be done by implementing it electronically, just a couple of questions electronically, or even asking a couple of questions by paper and pencil. So, as an example, in the United States, one of the physical activity guidelines is to encourage everybody to get at least a minimum of 150 to 300 minutes of moderate intensity physical activity per week. That we should be striving for a minimum of 150 to 300 minutes of moderate intensity physical activity per week. Now, the physical activity vital sign is a set of two questions to try to figure out if the patient or the client is meeting that minimum recommendation or not, or where they are on that on this guideline. And so there are two questions. One question is, on average, how many days per week do you engage in moderate to strenuous exercise, like taking a brisk walk? And this, the patient or client would simply give us a number from 0 to 7 days per week. So this is asking about their frequency, their exercise frequency, right? How many times per week? Question number two is, on average, for each of those days that they do engage in physical activity, how many minutes do they engage in the exercise for at that level? And so they would indicate then how many minutes each of those sessions they would spend doing this physical activity. So this is referring to the duration of the exercise session. So if we have the frequency and duration, if we multiply the two, the number of days per week times the number of minutes per day, that gives us the number of total minutes per week. And we can then see if they're meeting or where they are with that minimum guideline of 150 to 300 minutes of moderate intensity per week. So that's what we refer to as the physical activity vital sign. And we encourage this to be implemented at the healthcare system or the healthcare center. And of course, EIM or exercise medicine is not EIM without connecting the healthcare provider with physical activity resources that they can refer their patients to. In other words, if they if they find out their patient is not meeting the minimum recommendations, or they would like their patients to get more exercise, we want to be able to provide the healthcare provider, the doctor, the nurse, with exercise specialists or exercise resources that they can then send their patient to. So they can say, oh, I think exercise would be helpful for you. I think you can maybe start doing some physical activity like this. And we have this example here on the screen of this exercise prescription form that healthcare providers can use. They can just check a couple of boxes to start encouraging their patients to start moving, or they can hopefully send their patient to some exercise resource on campus as well, too, some physical activity resource on campus. Now, step 6, finally, is to continue to promote your EIMOC program year after year, because it's going to change. Mostly because students and faculty on the leadership team will change. And so because the people on the leadership change, we want to renew or update our registration with the ACSM. And now it's on a 2-year cycle. So every 2 years, we update the leadership team information. The renewal process is similar to the registration process, is that we simply report who the current EIMOC leadership team is. So this is also how ACSM gathers information about what different campuses have done and recognizes those campuses for the different levels of implementation. Campuses are recognized for how many of those 3 categories of activities they have completed. Simply, the first category of physical activity, awareness and promotion, will earn a campus bronze level recognition. If the campus has done some physical activity awareness and promotion, and they did some activities related to the next category, EIM educational activities, that will earn them silver recognition. Finally, a campus that completes all 3 categories, the physical activity promotion, educating people about what exercise medicine is, and they've implemented the physical activity screening at the healthcare provider level, as well as provide referral resources for the health providers, as in they provide exercise resources on campus. That then earns the campus a gold level recognition. Now that we've covered what exercise medicine on campus is and how to get your campus involved, please allow me to share CSUSB's journey. Of course, this is just an example. There's no right way of doing this. The way your campus might implement EIMOC could look very different. And I hope that sharing a little bit about our story might give you some ideas of what you can do as well. So, how did we get started? In our case, it was as simple as this email that I got on January 30th, 2017 from a student, Charlotte Hua, who wanted to start EIMOC at CSUSP. Prior to this email, she saw a presentation just like this one. It was given by um, somebody else that was talking about exercise as medicine, and she got really inspired. Actually, the presentation was given by Dr. Robert Salas, who started this whole initiative in the first place. And so he's very motivating and inspiring, and it got her to want to start exercise medicine on campus. So her message was as simple as, "Hi, Dr. Ng, I want to implement exercise medicine here on campus. Charlotte Hua, student in KIN 481. This is just my exercise physiology class." So I responded to her. I directed her to the action guide that we just covered, the 6 steps. And I said, start taking a look at that. If you want to do this, I would back you up 100%. And she started making a plan for assembling that leadership team, starting with connecting with our student health center. And so she reached out and started getting us connecting with the student health center in May of 2017. We connected with an individual there, Dr. Rochelle Maricino, who was the medical chief of staff. So she has some influence over all the other healthcare providers as well too. We presented the idea of exercise medicine to her. She was immediately on board. We were very fortunate to have already had somebody that was already interested. It didn't really take very much convincing to her to say that exercise is pretty important. She was absolutely agreeing with that. She's like, yes, exercise is absolutely important. What can we do? And so she was on board right away. So the team formed on May 22nd of 2017. It comprised of a lead advisor, that was me. So I served as the advisor to try to help everybody come together. We mentioned that the medical or the healthcare professional was going to be Dr. Rochelle Maricino. So she agreed and stepped into that role. Now, what about the health fitness professional, the person that would represent the exercise side? That was me as well. And so at the time when we were organizing this team, the ACSM allowed for if that was the background of the advisor, the exercise was the exercise was the background of the advisor, that we could hold both of those positions. Then what about our students? Well, of course, I just introduced Charlotte. Charlotte Hua was one of the student representatives. And then she just got her friend to join along as well too. They were both in my exercise physiology class. They sat next to each other. And so Elizabeth Toisson was the other one who got involved and became the other official student representative. And we started implementing some things. They created an Instagram account. They started posting things to encourage people to start moving around. I started working with Dr. Rochelle Maricino to figure how we can start asking patients about how much physical activity they were doing. And so these were the activities that we started on over the next few months. We started pretty simply. Now, 8 months later, our leadership team expanded. Later on, we added an individual named Valai Del Rossi to the group. So Valai Del Rossi at the time just got hired to our campus to join the Student Recreation and Wellness Center. He was one of the assistant directors of the Student Recreation and Wellness Center. He came from a different Cal State institution that already had exercise medicine on campus. And so he had some background with this already. And he reached out because he saw that we had an EIMOC program, just like in the 6 steps. Step 1, find out if your campus already has one. He found out our campus has one. And he reached out and he brought up this idea of collaborating and seeing, is there anything that we can do to work together? That is, can we unite kinesiology, the student health center, and the Student Recreation and Wellness Center? Wow, what a wonderful idea. He officially joined the team as the health fitness professional. So he replaced me on the exercise, the health fitness professional side of things as that representative. And he joined the team on January 2018 during the first year of renewal. So every year we had to renew. And during that first renewal, we added his name on that team. This was a major step because he brought with him so much enthusiasm, ideas, and resources from the Student Recreation and Wellness Center too. So these are the big three main groups that we have now: kinesiology, Student Health Center, and the Student Recreation and Wellness Center that now is working with all of our students. So these are a couple of examples of program offerings that we had. For kinesiology, we started providing exercise consultations where kinesiology students served as interns and can give exercise testing as well as give exercise recommendations, basic ones, to any student on campus that was interested in learning about their level of fitness and what to do. The Student Health Center began screening student patients on physical activity levels. So that the physical activity vital sign was implemented at the check-in process. That means that when a student checks in for their appointment, they're asked how many days a week do they exercise and for how many minutes per day, which we can then use to gather how long or how much exercise they're getting per week. The health center also provided health education. They provided programs and workshops to educate students about health. The Student Recreation Center, of course, offers group fitness, personal training, and a variety of physical activity promotion and events. Students, what about students? The students formed a club. They formed a club to promote physical activity on campus. So the Instagram was a pretty great way for them to share or spread awareness or messaging. They organized group walks. They measured blood pressure out in the quad. They organized scavenger hunts. And so they're just trying to do things to start promoting physical activity on campus. Then a year later, we have to renew again. We have to, again, update our registration. And so we began preparing for the annual renewal process. This was when Valide suggested maybe we can apply for recognition too. He said he brought up the idea that it seems like all the pieces were already in place. That is, bronze level activities, we were already doing physical activity promotion in all areas here. What about silver with exercises, medicine, and education? We've been doing those kinds of things. And then with the gold, with implementing the physical activity vital sign, in other words, does the health center ask about physical activity levels? Yes. And are they referring? Do they have a place to refer their patients to? Yes, they can refer them to kinesiology. They can refer them to the recreation and wellness. They can refer them to the student and the student clubs. So there were several referral sources. So that year, after submitting our renewal application, we were recognized on May 29, 2019 as a gold campus for the first time. And we just kept continuing to grow the program, offer a variety of activities, and each year we would just renew and update our leadership team and report the activities. And with renewal each year thereafter, we continued to subsequently earn gold campus recognition each year since then. We continue to think of ideas, which led us to our current endeavor. Maybe we can think about incorporating research. Now, research is not a requirement as part of EIMOC programs, but as a researcher, some of us in our kinesiology department, we as faculty, we're researchers. We're also interested in learning. So we wanted to incorporate a research project into our collaboration. Valide, again, motivated and has all these ideas, returned back to the spirit of exercise medicine on campus. He reminded us that, remember how physical activity vital sign and the exercise referral should ultimately lead to individualized exercise prescription. And he suggested maybe the recreation center can start offering personal training. Just like personal training to patients that might need it. Just like when a patient needs to see a specialist for a particular health issue, if the healthcare provider deems that a patient can benefit from physical activity to curb and prevent future issues related to physical inactivity, because the patient might be at risk, the healthcare provider should be able to send that patient to a specialist, and in this case, an exercise specialist. So Valaya proposed a no-cost personal training program for clients who are referred by a doctor at the student health center. What a wonderful offering. With all the healthcare providers now on board and their recreation center offering personal training to the patients that the healthcare provider would refer, and kinesiology, as researchers, we felt like we needed to propose a pilot study of this collaboration. So in spring 2025, so just recently, the last few months, we launched a pilot study of the following research question. What is the effect of a patient referral and exercise professional intervention on physical and psychological health outcomes of students at a large urban university? To examine this, we set up the following experimental design. Participants are first referred to us from doctors at the Student Health Center. Criteria that they look for are obesity, hypertension, or any other risk factors for developing disease. And the idea is to connect those doctors eventually, the doctor and their patients eventually to some exercise resources. So then the patient is sent to me for screening, which I would then take them through the informed consent process, administer a health history questionnaire to ensure it's safe for them to exercise. And then I would help them schedule their initial pre-testing session with the personal trainer at the recreation center. Following the pre-testing, they would go through 5 weeks of personal training. Each week would include resistance training twice per week and aerobic exercise once per week. After the 5 weeks of training, the participant would undergo post-testing again. So the pre and post-testing would include health-related physical fitness tests. The fitness tests include measurements of muscular strength through the bench press and leg press 1RM. We also measured muscular endurance through a push-up test and a curl-up test. We're also looking at cardiorespiratory fitness through the Gherkin submaximal treadmill test. We can assess flexibility with a simple sit and reach test. We assessed body composition with bioelectrical impedance analysis, and then we can do a visual postural analysis as well. Now, these are health-related physical fitness variables, but we're also interested in psychological variables too. And so the pre and post test also included psychological questionnaires. We incorporated 3 psychological questionnaires. Stress was measured with the perceived stress scale. Anxiety was measured with the state trait anxiety inventory. And depression is measured with the Center for Epidemiological Studies depression scale. Lastly, physical activity is measured through assigning a physical activity tracker to each participant that they would wear throughout the 5-week intervention. Variables that would be monitored include steps taken, exercise data during the aerobic exercise sessions, and sleep behavior. So where are we with this? We've been recruiting participants since March 2025, so just for 2 months now. We're currently still recruiting. We're training a few participants, and we will be ongoing into the summer collecting data. We're hoping that preliminary data could be expected by the end of summer 2025. So I'd like to begin closing this presentation by sharing some lessons learned and ideas for future directions. Some important lessons we have learned include the following. Regarding the renewal process, we had to keep in mind that while the main advisor, medical professional, and health fitness professional, the 3 of us work on campus, it's easier for us to remain on the leadership team year after year. The student representatives, though, there's a very high turnover rate there, simply because they graduate. And so they graduate and they have to leave. It's not difficult to find students to get involved, though, because many students have a passion for physical activity. We simply do have to keep this in mind when we renew each year or each time. Also, part of the recognition process asks for an estimate of how many student patients were assessed on their physical activity levels at the healthcare provider level. So having some way of documenting that is helpful. In our case, we used electronic records, but it takes time to access those records. So we simply have to plan ahead when we need to get those numbers. What are some future directions? We have taken our program through different directions and had a variety of activities. And our research interest has been on, or our recent interest has been on research efforts. So As long as my colleagues at the Student Health Center and with Student Recreation and Wellness want to continue to collaborate, and as long as they would allow us to do research on these activities, I absolutely would like to further our research agenda on this area. For example, we're already noticing a discrepancy between the number of patients who are referred to me and the number of patients who actually follow through and book an appointment with me to set up personal training. In other words, several patients are told by their doctor to exercise and they're being offered free personal training, but many are still not following through to get this personal training. Our current study is a pilot study, and it's already leading to other research questions like that one of why is there this discrepancy between um, who's actually coming to enroll into an exercise program. Overall, I think we can still learn a lot about how to more effectively develop the collaborations between healthcare and exercise professionals in order to help people to be physically active, to prevent, treat, or manage diseases. Opportunities to speak at events like this one here at IOHSK annual conference can help us spread awareness. So I think we're all moving in the right direction. That concludes this presentation. To the organizers of the IOHSK annual conference, thank you very much for giving me the opportunity to share. And to our audience, to you, thank you so much for taking time to take in this message. I hope you found something insightful or helpful, and I would be happy to answer questions or to even help you build your EIMOC program as well too. May we all be safe, healthy, and happy on our journey of helping others. Thank you so much. Take care.